For our diagnosis, we had to go through some investigations which included CBC, ESR, CRP, B scan, and CT scan. Coming on to the CBC, as you can see that the CBC findings were all normal except one abnormal finding, which was a WBC count which was raised way above our normal limit. Similarly, the ESR was raised as well. As you can see that it was 114. CRP was raised as well, 100 milligram per liter, and this is the B scan of the patient, which showed that there was marked swelling of the lateral rectus muscle, as you can see. And this is the lateral rectus muscle, which is quite raised from its normal limit. This was the CT scan of the patient, and it concluded that there was bilateral preseptal cellulitis with left-sided post-septal extension, where it involved superior oblique and lateral or superior rectus muscles. There was presence of air locule, suggesting that there had been underlying infective disease process involved. We did the blood culture as well, which came back negative after 7 days of incubation. So after going through the history, clinical examination, and a set of investigations, we came to the conclusion that the patient was suffering from left orbital cellulitis with bilateral preseptal cellulitis. So we started her on IV antibiotics, which included coamoxiclav, ceftazidime, metronidazole, and for her fever we started her on Proas infusion, which was going for 3 times a day. An oral antihistamine was given as well, and to cover her ocular infection we started her on moxifloxacin eye drops and ufloxacin eye ointment. In addition to that, we started her on an steroid injection with the advice of our ENT department, along with omeprazole infusion, and we started her on injection Toradol as well whenever she needed it, and along with that, nasal douches with nasal washes 3 times daily, as well as xenazine nasal spray were given as well. So this is the status of the patient on the 5th day of admission, and as you can see that she has been significantly improved. The pain, inflammation, and edema had been reduced significantly. However, there was slight restriction in her left extraocular movements. So what happened during her 14 days of hospital stay was that she was treated on IV antibiotics. Complete general physical and ocular examination was done on a daily basis. The patient was also examined by the ENT department on a regular basis, and the steroids were tapered down gradually and stopped during this course. So this is the